Pancreatic cancer has a reputation as one of the hardest cancers to catch early, and there's a real reason for that. Unlike a lump you might feel, or a mole you might notice changing shape, the pancreas sits deep inside the abdomen, tucked behind other organs, completely out of reach of any physical exam. It doesn't announce itself the way other cancers sometimes do. Instead, it tends to whisper through symptoms that look almost exactly like ordinary aging, stress, or digestive trouble. That overlap is exactly why awareness matters so much here. Today we're going through 8 specific symptoms that medical research has consistently linked to pancreatic cancer, especially in adults over 60. None of these symptoms guarantee cancer on their own. Most of them have far more common and far less serious explanations. But when one or more of these patterns shows up and sticks around, especially in combination with others, it's worth a real conversation with a doctor, rather than a quiet assumption that it's just getting older. Before we go through the list, it helps to understand why early detection makes such a dramatic difference with this particular cancer. When pancreatic cancer is found at an early stage, before it has spread beyond the pancreas, treatment options are considerably more effective and outcomes are meaningfully better. Once it spreads to nearby organs or the bloodstream, treatment becomes far more difficult. That single fact is the entire reason this conversation matters. Not to create fear, but to close the gap between when symptoms start and when someone actually mentions them to a doctor. So let's walk through these 8 signals one at a time, starting with one that's deceptively easy to explain away. Symptom 1, unusual changes in urine color. It's a small thing that's easy to brush off. Urine looks a little darker than usual. More amber, sometimes closer to brown, and the instinctive response is almost always the same. Drink more water. Often the color does lighten a bit after rehydrating, which feels like proof the problem is solved. Here's what's actually happening in some cases, and it's worth understanding the mechanism. The pancreas sits right next to the bile duct, a small tube that carries a substance called bilirubin from the liver into the intestines. Bilirubin is part of what gives urine its normal pale yellow tone. If a tumor develops in the head of the pancreas, the portion closest to the bile duct, it can press against that duct and partially block it. When that happens, bilirubin can't drain the way it's supposed to, so it builds up in the bloodstream, and the kidneys filter out the extra amount through urine, turning it noticeably darker. The detail that matters most here is persistence. Simple dehydration resolves with water and stays resolved. A blockage caused by something pressing on the bile duct tends to come back. The urine lightens briefly, then darkens again within a day or two, because the underlying cause hasn't changed. If urine color has been cycling between normal and unusually dark for more than a couple of weeks, regardless of how much water is being consumed, that's a pattern worth mentioning at a doctor's visit, not something to keep solving with another glass of water. Symptom 2, yellowing of the skin or eyes, known as jaundice. This follows the same underlying mechanism as the urine symptom, just at a more advanced stage. When bilirubin builds up significantly enough in the bloodstream, it starts depositing in body tissue, giving the skin and the whites of the eyes a yellowish tint. In people with darker skin tones, this often shows up most clearly in the eyes and the palms of the hands, rather than across the skin broadly. There's often an additional symptom that comes along with jaundice that catches people off guard: persistent itching across the body, with no rash and no relief from lotion or typical anti-itch remedies. This happens because bilirubin deposits irritate nerve endings in the skin directly, rather than being caused by an allergic reaction or skin condition. It's worth being clear about something important here. Jaundice has several possible causes, and gallstones are a notably common one, particularly in older adults. Because gallstone-related jaundice and pancreatic-related jaundice can look identical on the surface, it's genuinely important that any episode of jaundice gets a thorough medical evaluation rather than an assumption either way. The goal isn't to self-diagnose which cause is more likely. It's simply to make sure jaundice never gets dismissed without a proper workup, since the underlying cause can range from very manageable to far more serious. Symptom 3, persistent pain in the upper abdomen that radiates to the back. Abdominal discomfort gets blamed on a long list of things: overeating, indigestion, an old back injury, general muscle strain. And most of the time, those explanations are perfectly accurate. But pancreatic-related pain tends to have a fairly distinct pattern that's worth knowing. It typically begins as a dull, persistent ache centered in the upper abdomen, just below the breastbone, sometimes leaning slightly to the left rather than centered low in the belly. From there, it often doesn't stay isolated. It can extend around the torso and settle into the middle of the back, which is part of why it gets mistaken for a back problem so often. The pancreas sits near a dense network of nerves, and when something presses on or irritates that area, pain signals can radiate outward in ways that don't match where the actual problem is. A few additional details tend to set this pattern apart from ordinary back or muscle pain. It frequently worsens within 30 to 60 minutes after eating a meal. It often intensifies when lying flat, which is why some people find themselves more comfortable sleeping propped up or in a reclined position without fully understanding why. and it tends not to respond meaningfully to standard remedies like over-the-counter pain relievers or a heating pad, providing little to no lasting relief. None of this is meant to suggest that every instance of back or abdominal pain warrants alarm. Most cases genuinely are muscular or digestive in origin. But if pain consistently follows this specific pattern, upper abdomen, radiating to the back, worse after eating, worse lying flat, and unresponsive to typical pain relief, that's a detailed, specific description worth bringing directly to a doctor, since specific symptom patterns tend to lead to more targeted and useful testing than a vague mention of "my back's been bothering me." That brings us to a fourth symptom that often goes completely unspoken, simply because it doesn't feel like a medical issue at all. It feels like something happening quietly at the dinner table, one small portion at a time. Symptom 4, losing your appetite and feeling full after just a few bites. This one tends to creep in so gradually that it rarely registers as a medical symptom. A plate that used to be finished without thought now feels like too much after just a few bites. The natural explanation people reach for is simply that their appetite has changed with age, or that they're just not as hungry as they used to be. There are a couple of physical reasons this can happen when it's connected to the pancreas. A tumor growing in or near the pancreas can press against the stomach, which sits directly in front of it, physically reducing how much space is available before the stomach feels full. At the same time, the pancreas plays a key role in producing digestive enzymes that help break down food. When that process is disrupted, food can sit in the stomach longer than usual, which reinforces that early sense of fullness and reduces appetite even further. The downstream effect of eating less consistently, especially when paired with reduced nutrient absorption, is unintentional weight loss. And this is genuinely one of the more important details to pay attention to in general health, not just in the context of pancreatic cancer. Losing a meaningful amount of body weight, generally more than around 5% over 2 to 3 months, without any change in diet or exercise, is considered a significant warning sign across many conditions, and it deserves medical attention regardless of the eventual cause. If meals are consistently being left unfinished and weight is dropping without any deliberate effort, that combination is worth describing clearly to a doctor, rather than treating as an unexplained but convenient bit of good luck. Symptom 5, unexplained blood clots. This is a connection that surprises a lot of people, including some who have actually experienced it. A blood clot, often in the deep veins of the leg, shows up with no obvious trigger, no recent surgery, no long flight, no period of prolonged immobility that would normally explain it. Certain cancers, including pancreatic cancer, are associated with changes in how blood clots, sometimes making the blood more prone to clotting than usual. When this happens in the legs, it typically causes swelling, warmth, and a dull, heavy ache in the calf or thigh that doesn't improve with rest or elevation. The serious concern is that part of a clot can occasionally break free and travel to the lungs, a condition called a pulmonary embolism, which can cause sudden shortness of breath, sharp chest pain that worsens with breathing, and a rapid heart rate. If those symptoms appear suddenly together, that's a medical emergency requiring immediate care, calling emergency services rather than waiting for a regular appointment. To be clear, the overwhelming majority of blood clots happen for far more common reasons: prolonged sitting, certain medications, clotting disorders, or other unrelated health conditions. But research has noted that in some pancreatic cancer cases, an unexplained clot appeared before the cancer was otherwise detected. Because of that, a blood clot with no clear cause is generally something doctors already take seriously and investigate thoroughly. And if it's happened to you or someone you know recently, it's reasonable to ask directly whether further evaluation, including imaging, has been considered. Symptom 6, persistent low-grade fevers that come and go. A fever that shows up, fades after a day or two, and then returns again days later, often gets written off as a recurring minor bug or seasonal virus. And in most cases, that's exactly what it is. But there's a particular pattern worth being aware of. A cycling fever that never fully resolves, paired with night sweats, waking up damp without having felt overheated, that persists for weeks without a clear infection being identified. This pattern can occur because cancer, including pancreatic cancer, can trigger ongoing inflammation in the body, which the immune system responds to in ways that produce these low-grade, recurring fevers rather than one clear, resolving illness. The fevers in this pattern tend to be mild, often just a degree or two above normal, but persistent and recurring rather than a single dramatic spike. If a fever pattern like this continues for more than a couple of weeks without an identified cause, no diagnosed infection, no clear illness running its course, that's a situation where asking a doctor directly about further investigation, rather than simply treating each episode as it comes, makes a meaningful difference. Symptom 7. A specific kind of fatigue that doesn't improve with rest. Everyone experiences ordinary tiredness, a late night, a physically demanding day, ongoing stress. The defining feature of ordinary fatigue is that it responds to rest. A good night's sleep, a quiet weekend, and energy levels generally bounce back. The kind of fatigue sometimes associated with pancreatic cancer behaves differently. It can persist even after a full night's sleep. Simple tasks that were never previously a struggle, walking to get the mail, carrying groceries, climbing a single flight of stairs, can suddenly feel disproportionately exhausting. Rest doesn't restore energy the way it normally would. Part of the explanation involves how cancer cells affect the body's metabolism, competing for glucose and nutrients that would otherwise fuel normal cellular function, which can leave the body running with less available energy, regardless of how much rest is taken. This kind of fatigue often overlaps with the appetite and weight changes mentioned earlier, compounding the overall sense of depletion. To be fair, persistent fatigue has an enormous number of possible causes that have nothing to do with cancer. Anemia, thyroid imbalances, depression, sleep disorders, and simple overexertion are all far more common explanations and should be considered first. But fatigue that's been unusually heavy and unresponsive to rest for several consecutive weeks, particularly alongside other symptoms on this list, is worth raising directly with a doctor as its own distinct concern. Symptom 8. Pale, greasy, foul-smelling stool. This is one of the more specific and physically distinct symptoms on this list, and it's directly tied to how the pancreas functions. The pancreas produces enzymes responsible for breaking down fat during digestion. When a tumor blocks the duct that carries those enzymes into the small intestine, fat from food passes through the digestive system largely undigested. That undigested fat changes the appearance of stool in noticeable ways. It can become pale, sometimes described as clay-colored or gray rather than the usual brown, along with a greasy or oily appearance, a tendency to float rather than sink, and an unusually strong, foul odor. This is often accompanied by nausea, particularly after eating fatty or rich meals, and a general sense of bloating or discomfort following meals. Because fat isn't being properly absorbed, this can also interfere with the absorption of certain fat-soluble vitamins, which can compound fatigue and weight loss over time. If a stool pattern like this persists for more than 2 weeks, it's specific and unusual enough that it warrants a phone call to a doctor, rather than being chalked up to a particular meal or temporary stomach bug. That covers all 8 symptoms in detail. In the final part, we'll bring everything together, how these symptoms often overlap and reinforce each other, what a genuinely useful conversation with a doctor looks like, and the practical steps that actually make a difference in catching something early rather than letting it go unspoken. Now that we've gone through all 8 symptoms individually, it's worth stepping back and looking at how they actually tend to show up in real life, because pancreatic cancer rarely announces itself through a single isolated symptom. More often, it's a combination that develops gradually, maybe darker urine that keeps cycling back, paired with reduced appetite and a few unexplained pounds lost over a couple of months, or persistent upper abdominal pain alongside fatigue that doesn't improve no matter how much rest is taken. It's the overlap and the persistence that matter most, far more than any single symptom appearing once. This is exactly why it's so important not to evaluate these symptoms in isolation. A single dark urine episode after a hot day with insufficient water intake means very little on its own. But dark urine that keeps recurring, combined with appetite changes and unusual fatigue over the same stretch of weeks, paints a very different picture. One that deserves a real conversation with a doctor, rather than 3 separate explanations that each sound reasonable individually. So let's talk about what actually makes that conversation effective. Because how a symptom gets described to a doctor genuinely changes the quality of the response and the testing that follows. The single most useful thing anyone can do is be specific rather than vague. Saying, "I've been feeling a bit off lately," rarely leads to targeted testing, simply because it doesn't give a doctor much to work with. Saying something like, "My urine has been cycling between dark and normal for 3 weeks, regardless of how much water I drink. I've lost about 12 pounds without trying, and I've been getting full after just a few bites at meals." It gives a doctor concrete, specific details to act on. Specific symptoms, especially when several appear together, tend to prompt more thorough investigation, sometimes including imaging like an ultrasound or CT scan of the abdomen, rather than a symptom being treated individually and in isolation. It's also worth saying clearly, bringing up a possible connection to pancreatic concerns is not being dramatic or overstepping a boundary with a doctor. It's entirely reasonable to ask directly whether further imaging or testing is appropriate, particularly when multiple symptoms from this list have been present together for several weeks. Most doctors genuinely appreciate a patient who comes in with clear, organized information, rather than a vague sense that something feels different. At the same time, it's important to hold on to some perspective here. The vast majority of dark urine, abdominal discomfort, fatigue, or appetite changes turn out to have far more common and far more treatable explanations. Dehydration, irritable bowel symptoms, medication side effects, thyroid issues, or simply the ordinary ebb and flow of getting older. The purpose of going through this list isn't to create anxiety around every minor stomach ache or tired afternoon. It's to make sure that when several of these specific patterns genuinely do show up together and persist, they don't get quietly absorbed into "that's just aging" for months at a time, because that delay is exactly where outcomes tend to diverge the most. That's really the core message worth taking away from all of this. Early stage detection of pancreatic cancer is associated with meaningfully better treatment outcomes than detection at a later, more advanced stage. The biology of the disease doesn't change based on when it's found, but the range of available treatment options absolutely does. And the only variable that actually separates an earlier diagnosis from a later one is how quickly a persistent, unusual pattern of symptoms gets raised with a doctor instead of explained away. So here's a practical way to put everything we've covered into action. If, while listening to this, something resonated,